Hey guys, and welcome back. If you are looking for a way to boost your income as a social worker or a helping professional, stick around because today we are talking about the 5 steps that it takes to earn additional income as a side hustle, writing in-network contracts. So stick around if you're interested. Please hit the subscribe button below. We have the best side hustle tips for helping professionals and social workers, and we drop a new video every Tuesday. Hit the little bell to get the reminder when we drop a fabulous new side hustle video. Moving on, I'm Tiffany Tait, licensed clinical social worker, certified daring wave facilitator, and serial entrepreneur. Myself and my business partner built a very large financial portfolio, but we did that by utilizing small scale side hustles that we started with years ago and turning those into larger equity deals. For this entire playlist, we just go through all the little side hustles we've used along the way to generate additional income that we reinvested. So today we're jumping right in. First one is step 1. What is an in-network contract negotiator? So an in-network contract negotiator is a person responsible for taking a provider. This can be a private practice provider, a hospital, a doctor, a nurse that can bill, like an ARNP, anything of that sort. Any sort of provider that provides a service that can be billed for in insurance, and they build the relationship and establish the relationship with an insurance payer. Whether that's public insurance like Medicaid or Medicare, or private insurance like Humana, Cigna, Blue Cross. This individual kind of bridges that gap between the insurance payer and the provider and negotiates the in-network rates that pays the provider every time they see a patient that's insured by that payer. So what does it look like to be an in-network contract negotiator? That's step 2. It's pretty simple. You're an independent consultant. You work for yourself. You set your own rate. This is usually done on an hourly rate, not usually done on a project rate. And that's simply because it's more and more difficult these days to negotiate higher rates. So most people would want their money up front, as it's harder to negotiate that. However, you are your own boss in this situation. You set your own hours, you set your own rate, you work for yourself, you pay your own taxes, and a provider hires you to be able to negotiate on their behalf and establish a rate with the payer or provider, or public or private payer. Step 3, research. So you're probably thinking, how can I be an in-network contract negotiator? I have no clue how to even start this. That's exactly what you're going to start. This is what we teach you. We tell you where to go look, you pick it up, you find the pieces, and you get it done, right? So for an in-network contract negotiator, you're going to start by looking for actual sample contracts. You could Google this. Look for an Aetna provider contract, or Google Humana provider contract, and see what examples come up so you have an idea. But what's even more beneficial to you would be consider your friends. Do you have anybody that you know that's in private practice that has a sample contract? They don't mind showing you to give you an example of the way one should be worded. Look around, Google it. Ask friends, ask anybody, a coworker that you know of. If you work in medical billing, you see these all the time, so you know what the wording looks like in these. But you're looking for a few things in these contracts. Number 1, you're looking to see the terminology and the trends. So if you see contracts that are being written in 2021 with Aetna, are they paying a certain amount for a certain level of care versus Cigna paying something significantly more, significantly less? What sort of trends are you finding during your research? Because you know where to kind of start your negotiations and with what companies. You're also going to want to research the different provider relations phone numbers or departments, because that's who you're going to be reaching out to build a relationship with and to start the negotiations on behalf of whoever hires you. You also need to be looking for the rates across the board at different levels of care. So you may say, I only specialize in radiology and writing those contracts. You're going to want to look at all the different services that you can be billing for under radiology and the different rates that are going for those. Same thing for substance abuse, same thing for mental health, right? You also want to research value-based contracts. This is really important. Most people don't even know about these, even if they're in private practice. You want to look into value-based contracts because these allow for you to write kind of a caveat into the contract depending on outcome studies that you would follow follow throughout the year in your patients, that you can actually get more money at the end of the year back from the insurance companies, depending on the prognosis and, kind of the outcomes of the people you have serviced. So this is something else as a negotiator that you can kind of write in and expand on the negotiations as you're doing those. So looking for sample contracts from providers, and you're also looking for value-based contracts. Those are the Google terms you're looking for. Step 4, get in there. So now that we know what a few of these contracts look like, the terminology, the trends, the rates that they're paying, you're going to want to go and look up, this is public information, those same exact codes and procedures and how much those rates you can get for those. You want to look and check that against the Medicare. As of current, you can check this any day, Google CMS Medicare reimbursement rates. You could put in the code for the service and immediately it'll tell you what Medicare is paying. Your goal as a contract negotiator is to land somewhere within the 90% or 150% range of the Medicare rate for that service. This is what people are looking for. And if you're able to negotiate within that rate, you are able to lock in contracts because you're providing, industry standard rates, right? And industry standard outcomes for your services. So get in there and really start to compare that information to the Medicare published rates. Step 5, getting paid. So this is not usually one of those hustles that you can really cut yourself into the deal. This is either going to be done by a project rate, which I don't necessarily suggest unless you have a lot of experience in this, or an hourly rate. The hourly rate can range anywhere from $75 an hour to I've seen $150 an hour. This is something you're going to scale up with. If you do not have a lot of experience in this and you can't really back this up yet, you're starting on the $70 to $75 an hour consulting rate. And as you have outcomes, the more contracts you negotiate, the better contracts you're able to negotiate over time, the more you can charge per hour because you have the proof in the pudding now of what you can produce. But just starting off, even $75 an hour as a social worker, working on your own time, reading up on contracts, and just making a few phone calls and writing a few letters, because that's what this comes down to with the contract negotiations, is surely some good money for a social work side hustle. If you enjoy our side hustles, hit the subscribe button below. We appreciate you guys. See you guys next week.